First of all, I would like to thanks to Dr. Pramod Kumar sir for giving this opportunity to make slide on thrombocyte count and represent ourselves in front of you. Thank you, sir, for this opportunity.
Thank you, sir. Now on the topic introduction of platelet.
First of all, I would like to tell you what are platelets. Platelets are small colorless disc-shaped cell fragments present in blood. They are also known as thrombocyte. They are about 1.5 to 4.5 lakh per mm cube of blood. Their main role is blood clotting. Now coming on the topic, origin of platelet in animal body.
The platelet are formed in the bone marrow. They originate from the large cells called megakaryocyte. Megakaryocyte break into small fragments which becomes platelet. Platelet lifespan is about 7 to 10 days.
Now coming on the function and uses of platelets. First of all, they help in blood clotting and preventing excessive blood loss and thus saving many lives. Form platelet plug at the site of injury, release chemical that help in wound healing and maintain integrity of blood vessels. Now coming on the function and uses of platelet.
The blood clotting, wound healing or immune response or growth factor release. Now coming on the topic platelet and coagulation.
Let me tell you the mechanism of blood clotting. First of all, any injury occur at any site, then there is a release of substance called thrombokinase. Whenever it comes in the contact of calcium, it makes thromboplastin, which convert prothrombin that have been released from the liver at the site of injury, convert into thrombin. That thrombin later convert fibrinogen into fibrin, and that fibrin make mesh-like structure which we call soft clot at the site of injury. Whenever it come in contact with the air, it make hard clot. Now coming on the topic, experiment related to platelet, that is bleeding test. What is bleeding test? It is used to assess platelet function. How the mechanism work? First of all, there is a small cut or puncture made at the skin, and the time of bleeding is recorded. Whenever it exceeds 2 to 7 minutes, then there is a decrease in platelet count or any injury, any disorder related to platelet. Now coming on the experiments.
The platelet count. The principles: a known volume of the blood is diluted 200 times by a diluting fluid which is made by the platelet. The number of the platelet present in is known as the volume of diluted fluid. Blood is counted from its number of the platelet present in one of the cubic mm of the blood in calculated. Now coming to the topic requirement.
Hemocyte, whatever we require is hemocytometer with cover slip, microscope, RBC pipette and petri dish. And diluting fluid we use is Rees-Agar fluid. Now coming on the composition of the Rees-Agar fluid.
The sodium citrate 3.8 gram, 40% formalin 0.2 ml, brilliant and crescile blue 0.05 gram, distilled water 100 ml. The sodium citrate is isotonic and anticoagulant. Formalin acts as the preservative, antifungal and antibacterial. The brilliant crescile blue is used as the staining of platelet.
Now coming on the procedure. First of all, we collect a fresh sample of blood in EDTA in a clean dust-free vial. Now draw the diluting fluid up to 1 mark in RBC pipette and blow out the content just to moisten the pipette, which prevent sticking of blood in the glass wall. Now draw the blood up to 0.5 mark to 101 mark. Shake the pipette for 5 minutes. Now expel the first few drops to remove the cell-free fluid content from the pipette. Charge both of the hemocytometer counting chamber. Now allow the cell to settle down for 15 to 20 minutes. Now observe it under the microscope for per mm square of area. Now coming on the calculation.
The platelet count, the number of platelet count multiplied by area, multiplied by depth, multiplied by dilution. AX1 multiply 0.1 multiply 200 is equal to AX 2000 ml of the blood. Result platelet count 3.6 multiply 166 ml cube of the blood.
There is a minor correction. Here it was 10.6. You may note it. Now coming on the disorder related to platelet.
Thrombocytopenia, decrease in the platelet count. Thrombocytosis, increase the platelet count. Idiopathic thrombocytopenic purpura ITP, dengue related platelet reduction.
These are the injured animal that will heal from blood clotting. Now coming on diagnosis and cure of platelet and disorder.
Diagnosis: complete blood count CBC, peripheral blood senior bone marrow examination, treatment underlying cause, the platelet transfusion, steroid or immunotherapy in IDP. Now coming to the topic, low platelet count in dogs.
Low platelet count in dog happened due to following reason: hemophilia, one Wilbrand disease, coagulation disorder, leukemia, vitamin K deficiency, and intoxication. Now coming on impact on social life and health.
The low platelet count cause fatigue and bleeding risk, limit the physical activity and daily work.
Financial burden due to long-term treatment and mental stress and anxiety in patient and family. Thank you.
Thank you, sir.